Who is Dr. Daniel?
Okay, Dr. Daniel, I'm 67 years old. I live in Northern California in a small town a little south of Sacramento. And we live in the Zinfandel capital of the world.
Okay.
My partner and I live there. A little town called Lodi, California.
Okay, beautiful. It's a county of wine, right?
It is. We grow probably the oldest and best Zinfandel grapes, which are used by wineries throughout California and the United States. If you go on a cruise ship from Cancun, you will find Lodi wines.
Nice. Okay, and then let's start with your seek for a facelift. When did you start to see changes in your face?
Well, last October 2024, I had a heart attack. I had gained a lot of weight and I was very lucky to survive. And that was a real wake-up call for me. And what I did is I lost about 60 pounds over the next 6 to 8 months by exercising and changing how I ate. And as I lost the weight, being my age, I lost all the flexibility. I had all this extra skin on my neck, and my face became very drawn and wrinkled because I lost all the, in addition to losing fat on my body, I lost it in my face and neck. That's when I decided, well, I really should think about getting a neck and a facelift.
Okay, okay. And how was your pathway to reaching me?
Well, my partner Marianita loves to do research. She's very good at it. And she searched, we went on the internet. She went on the internet. And what I was looking for, what we were looking for was a surgeon who has a lot of experience doing the male face, very different, I think, than the female face, who has a level of training and expertise that most plastic surgeons do not. And that's why I ultimately decided to travel to Cancun to see you. You are a board certified head and neck surgeon. You do head and neck surgery. You know the anatomy, what lies under the skin of the neck and the head better than most plastic surgeons. But you also have the training in the aesthetic plastic surgical. So that dual training and that expertise and the openness with which you presented your results on your website, on Instagram, that's what drew me here. It's really your expertise as a head and neck surgeon combined with your eye for the aesthetic. And that was evident on your website.
Okay, thank you very much. And you talk with experience. Can you tell a little bit to the audience what about your previous career as a physician?
Oh, well, for many years I practiced as a pediatric neurologist, or a neurologist for children. And then I did a period of time as a medical executive with a large medical group. And now I work for a company and do consulting for them. But my work is in neurology.
Nice, okay. That's why you know about medicine and you know about surgery and about medical facilities.
Yes.
Here. Okay, perfect. And when you decided to come with me, how was the following period of time, the preoperative period?
Okay. Well, your office staff did an excellent job describing the arrangements to me, telling me what I needed to do ahead of time, telling me what I could do here when I arrived, arranging airport transportation, both from the airport and to the airport when I depart. It was all very clear. Your staff did an excellent job with that. Preoperatively, before the surgery, there were some evaluations, blood work, a chest x-ray. That was all easily done at the hospital, right where the surgery takes place. And then because of the fact that I had had a heart attack, you asked me to see a cardiologist here in town, which I was delighted to do.
What about the day of the surgery?
I arrived at the hospital. I was checked in, brought to my room. The hospital staff started the IV easily. I was then taken to the preoperative area. I met the anesthesiologist. I was brought into the operating room, placed on the table, and I went to sleep. That's what I remember. That was very smooth. I felt confident at that time. I was a little nervous the night before, but everything went very smoothly.
Nice. And when you wake up?
Yeah, it was a longer surgery, and it was dark out, but my eyes were quite swollen because that's just how my body responded to the surgeries that I had done. Upper lower blepharoplasty and a repair of drooping of my eyelids called blepharoptosis repair. And so they were quite swollen. I really couldn't see anything for a few days. And so I stayed in the hospital longer than I expected to, but that was okay.
Okay. Were you having pain at that moment?
You know, I really wasn't having a lot of pain at all. I was very surprised. A little bit of nausea, and that was quickly treated with medicine.
Okay, perfect. And when you were discharged?
When I was discharged, I was brought by your staff across the street from the hospital to my hotel room here, where I have a full kitchen and a very comfortable bedroom and bathroom in this living area. And I was, by that time, able to take care of myself.
Okay, okay. And that week, did you find that week hard or easy to?
Actually, it was quite easy because you have a wonderful recovery program that I took advantage of. Twice a day, one of your nurses would come over and clean my wounds, treat them, make sure that they were healing properly, make sure I took the medications you had prescribed for me. And, you know, whenever I had to come visit the office for whether it was stitches removal or hyperbaric treatment, oxygen treatments, the nurse would come and get me and walk me over there.
Okay, okay. So you feel comfortable, you feel safe?
Oh, absolutely.
Okay, perfect.
Absolutely.
And finally, what about the result?
Oh, the resort. It's very comfortable.
No, the result.
The result. Okay.
Okay, the resort. Yeah, tell me about the resort.
Okay, I'm sorry. Yeah, the hotel. It's really quite nice. The staff is very friendly. The food is very good. Before surgery, I went to a couple of the restaurants here, and food was delicious. If you take advantage of the suite, you have a premium level access. You have this little gold bracelet, and it's all inclusive. So I don't have to worry. After the surgery, I haven't been to the restaurants, and I've just been calling for room service. And there's a full market, Soyanas, across the way in the plaza where your office is. And I loaded up on various things for breakfast and lunch, and you know, protein smoothies, things like that.
Okay.
So that I was very comfortable in the room here.
Okay, perfect. And when did you finally saw your results of your face and neck?
Well, by the time I was back at the hotel, so the third day after the surgery, I was able to more clearly see, though there was still swelling, I could clearly see the results, particularly in my neck area, in the jawline. It looked so different than preoperatively.
Okay. Did you like it?
I loved it.
Okay.
Absolutely delighted.
Okay, thank you very much. And finally, two more questions. The first one is, if there's someone looking at the screen, seeing for this video, what can you tell them? Do you recommend coming with me? Do you recommend having a facelift?
Yeah, first I would say the decision to undergo a neck lift and the facelift, because they're connected. It's hard to just do one. So if you're going to do it, you might as well do it. If you're going to travel to do it, you should get it done, and get as much done as you think you reasonably can. And that was my rationale, and that worked out well for me. I additionally had some extra skin around my eyes that you very kindly took care of. Thank you. And do expect swelling. Do not, however, expect a lot of pain. I have had very little pain, and have been able to manage it either with nothing or just acetaminophen, Tylenol. I have not required anything stronger, fortunately. Now, the sensation of the face will change over time, because when the surgery is done, the nerves to the skin are interrupted, they're cut. And so expect sensation of the face to come back slowly over time. That's expected. And so you need to be careful. Like for men, you need to be careful shaving. You have to be, take care not to cut yourself or push too hard. I would also say that there are a lot of surgeons who have a lot of experience doing facelifts on the female face. I did not find that there were very many physicians with a lot of experience doing the male anatomy and the male face. And I think the reason I chose you is your practice, experience, and certification as a head and neck specialist. Because you were able to do things like reduce the size of some salivary glands underneath my jaw that were really quite prominent. And had I had the neck lift without a reduction in those glands, it would have looked funny. It would not have turned out as well. And you have the expertise to do that, and most plastic surgeons wouldn't get near that.
Yes, I think so.
So I absolutely recommend Dr. Carlos Rosales. I think his staff is wonderful. I think the overall recovery program is excellent. And I am just very grateful to have found you, sir. Thank you.
Thank you very much, Dr. Daniel. Thank you very much. Okay, so this was the testimony from Dr. Daniel. So I'm very thankful for you, doctor, for giving me your trust, trusting me your face, coming all the way from California to Cancun, and alone. So that everything of that talks about the trust you have gained on my work, and I'm very grateful with you. And thank you for watching this video, and hope to see you soon here in the office. Bye-bye.